Would you believe that there are people walking around right now who used to have type 1 diabetes, but who can now produce their own insulin? Why? Because they participated in a clinical trial that's been making waves. Of course, it's a stem cell therapy, so there are pros and cons, just the way there would be with any other medication. I'm going to cover all of that. I'm going to talk about why it's looking like we're on our way to a functional cure, some of the tragedies that the team have encountered along the way, and the future of this therapy. Once again, I'll be talking about Vertex Pharmaceuticals. Not their first appearance on my channel. You might remember them from my video on gene editing, where I discussed Casgevy, the CRISPR-based cure for a blood disorder called sickle cell disease. They've also been in the news for their cystic fibrosis drugs. But today, we're talking about their stem cell therapy for diabetes, formerly known as VX-880. And that's what I will continue to call it, as it is much easier to say than their new official name, which is on screen now. I don't think so. If you're wondering why drug names are always difficult and weird looking, I've got a short on that. Click on the card above to check it out. Vertex acquired this technology when they bought Sema Therapeutics in 2019 for a cool $950 million. The concept is an elegant mouthful. It is a fully differentiated, stem cell-derived pancreatic islet cell therapy. You'll recall from my video on Parkinson's that you don't want to just dump raw stem cells into the body. That can give you cancer. First, you turn those stem cells into the cell type of interest in a dish. Then you give them to the patient. That's the fully differentiated part explained. As for the rest, this is your pancreas. Within the pancreas, you've got your famous beta cells. They are found in groups of islets. Beta cells create insulin, a hormone that regulates your blood glucose levels. So let's say you've just eaten. When your blood glucose levels increase, your beta cells respond by secreting insulin. Why is insulin important? It helps specific cells absorb glucose from your blood. In type 1 diabetes, the immune system attacks and destroys these beta cells, so your body isn't producing enough insulin anymore, and your cells can't use glucose properly. How does this therapy help? Well, the goal is to replace the lost beta cells in a type 1 diabetes patient, enabling them to produce their own insulin again. These cells are infused directly into the hepatic portal vein in the liver. Why the liver and not back into the pancreas, you ask? Because it's minimally invasive, so it's convenient for everybody. There are low complication rates. You've got a nice oxygenated environment because circulation in the liver is super rich, and the liver badly needs access to this insulin anyway, so now it's right there. Vertex recently published data on VX-880, and the results are impressive. In their study, 10 of the 12 participants who received a single infusion of the full dose achieved total insulin independence, meaning they weren't using any external insulin at day 365 because they were producing their own. But here's the complicated part that I mentioned at the start. Because the stem cells don't come from the patients themselves, they come from somebody else, the patients need to be on immunosuppressants. So while it's a functional cure for the diabetic elements, you're replacing insulin shots with immunosuppressants. And this does carry real risks. There were 2 deaths in this trial that have been officially assessed as unrelated to the therapy. One was due to cryptococcal meningitis arising from an elective sinus surgery, and this person was given high-dose steroids in the weeks preceding and following that surgery. That's along with their immunosuppressive drug regimen from the VX-880 trial. So their immune system was further affected by the surgical protocol on top of what they were already doing in the trial, and this seems to have created the perfect storm in the very worst of ways. Lots of what ifs in a case like that, but again, the official line is that it was unrelated. Either way, it is a stark reminder of why this field is pushing so hard for therapies that don't mess with the immune system. The other death was also unrelated, and this is a little bit more straightforward, it seems. It was due to the progression of a pre-existing neurocognitive impairment arising after a traumatic brain injury sustained in a motorcycle accident. And this accident was actually caused by a severe hypoglycemic episode prior to study enrollment. Now, all this talk of immunosuppressants brings us to Vertex's other project, VX-264. The idea here was to put those same stem cells from a donor inside of a device that would be implanted into the abdominal wall. And the point of that device was to shield the cells from the immune system. That means, in theory, that no immunosuppressants would actually be required. There was a lot of optimism about it, but unfortunately, Vertex announced that while the device was safe, it failed to show efficacy. So Vertex has now discontinued this specific device program. So where does that leave us now? VX-880, the therapy that does require immunosuppressants, that one's moving full steam ahead and will probably see regulatory submissions this year. The phase 1-2 trial was upgraded to a phase 1-2-3 trial in 2025, which means they can better assess true efficacy during this stage rather than just safety like before. As for efforts to eliminate immunosuppression, the race is back on. You'll see the term hypoimmunogenic cell engineering a lot in the next research era of this therapy, which means making the cells invisible to the immune system through strategic gene edits along with other immune modulation techniques. We're right there. We're so close. But I don't think any doctor or scientist wants to break one thing to fix another. So from here on out, I think the name of the game is going to be refinement. We want to maximize the benefit and minimize the side effects. We want to balance that risk-reward ratio, as is the case with really any medication. In this case, VX-880 is being tested in patients with severe hypoglycemic episodes, which are defined as life-threatening drops in blood sugar when diabetes meds and lifestyle are out of sync. And these people are at risk of passing out, falling into a coma, brain damage, and even death. They also explain that these patients have impaired hypoglycemic awareness, meaning that they can't feel it when an episode is coming on. They can't get themselves to a safe place and deal with it to prevent escalation to those more serious complications. So not all type 1 diabetes patients would qualify for a therapy like this just yet. It's really for patients who find themselves in life or death situations, at least in its current form. That being said, it is a very live field right now. I will continue to monitor for updates, so stay tuned. And if you learned something, share this video with a friend.